Hi, my name is Ufoma Ibaroro, and here at the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Breathing Easier, SBHCs as Leaders in Addressing Environmental Asthma Triggers. Over the past 5 years, Regional Asthma Management and Prevention, RAMP, has been working with school-based health centers to be leaders in managing the environmental factors that make asthma worse. Using existing tools to support their work and case studies to inspire them, SBHCs across the country have been successfully implementing interventions that reduce environmental asthma triggers in homes, schools, and outdoor environments. During today's presentation, attendees will hear model examples from 2 SBHCs and learn about tools you can use to implement an asthma intervention on your campus to support your most vulnerable students. The School-Based Health Alliance is the national school-based healthcare advocacy, technical assistance, and training organization based in Washington, D.C. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based healthcare. As youth-friendly and accessible settings, school-based health centers are uniquely positioned to deliver high-quality, confidential services that equip children and adolescents with the information, tools, and support they need to be healthy and safe where they are when they need it in school. We believe that all children and adolescents deserve to thrive. When health and education come together, great things happen. Now we have a few housekeeping reminders. All attendees are in listen-only mode. However, we want to hear your questions. To ask a question at any point during the webinar, please use the chat tool located in your Zoom control bar. We will address questions following the presentation. At the end of this webinar, attendees will be asked to complete evaluation poll questions. Please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 1 to 3 business days. Please also visit the School-Based Health Alliance website for additional archive webinars for topics such as the ones you are viewing on your screen. Now, I would like to introduce our presenters for today. We will be hearing from Ann Kelsey Lamb, Director of Regional Asthma Management and Prevention, RAM, Molly Baldridge, Director of Engagement at the San Francisco Marin Medical Society, Dr. Amanda Duff, Director of Community-Based Programs at Whitney Young Health, Kay McLean Grant, Senior Nurse Practitioner at Christiana Care, and Todd Hartsoff, Senior Community Educator at Christiana Care.
Good afternoon. Thank you all so much for joining us today. Our presentation has 3 objectives. We hope that by the end of this presentation, you as participants will be able to describe the role of school-based health centers in reducing asthma disparities and chronic absenteeism. You will be able to access tools to support school-based health centers in reducing exposure to environmental asthma triggers, and you will be able to identify best practices for reducing environmental asthma triggers in schools and communities that are replicable across the field. Since you chose to join this webinar, you're likely already familiar with what a significant public health issue asthma is, but just to start with some basic statistics. Over 7 million children in the United States have been diagnosed with asthma. It is the most common cause of disability among children in the United States and a leading cause of school absenteeism. Asthma affects children of all ages, races, and ethnic groups. However, it is a disease in which we see significant disparities. Here we have a graph showing asthma prevalence, and I've highlighted the three groups with the highest prevalence, starting from left to right: Black, non-Hispanic, Puerto Rican, and people living below 100% of the poverty line. So how do we go about reducing the burden of asthma and starting to address these disparities? I've always felt lucky to be working on a public health issue for which there are such clear guidelines. What this slide shows is a summary of the guidelines developed by the National Institutes of Health. They describe 4 vital components of asthma management. I've highlighted the last one, environmental control measures, because it's the one least likely to be addressed. Yet it is so important. Even children and adolescents with the best medically managed asthma will continue to suffer if their home, school, and outdoor environments expose them to environmental asthma triggers. So what exactly do we mean by environmental asthma triggers? They're generally divided into 2 categories: allergens and irritants. Allergens cause the body to mount an inappropriate immune response to a benign protein or allergen. Allergic reactions are caused by the body's own immune system. Examples of allergens that trigger asthma include pests like rodents and roaches, mold, dust mites, furred and feathered animals, and pollen. An irritant is a substance that causes inflammation and discomfort in the body. This reaction is not primarily a result of the body's immune system. An allergic reaction requires prior sensitization, whereas an irritant does not. Irritants that exacerbate asthma include environmental tobacco smoke, many cleaning products, scented personal products, gas stoves, wood smoke, and outdoor air pollution from trucks, cars, and industries. We know that school-based health centers are leaders in addressing asthma. 90% of school-based health centers across the country have chronic disease management programs, and we know that school-based health center users are less likely to go to the emergency department or be hospitalized for asthma, less likely to have asthma-related restricted activity days, and less likely to miss school as a result of their asthma. Over the past 5 years, we have been working with school-based health centers to also be leaders in managing the environmental factors that make asthma worse. Using existing tools to support their work and case studies to inspire them, school-based health centers across the country have been successfully implementing interventions that reduce environmental asthma triggers in homes, schools, and outdoor environments. Model examples include school-wide policies, youth-led behavior change, and improved classroom environments, all replicable to the field. We began our work by developing this tool, a guide on asthma environmental interventions for school-based health centers. We presented on this during a past webinar, so I won't go into detail, but I do want to point out the at a glance page, which is on page 54 of the guide, because this shows an overview of what's included. We have 5 broad strategies: education, case management, improving indoor air in schools, improving the students' home environments, and improving outdoor air quality. Within each strategy, we provide information about evidence-based approaches. Then there's a section on how school-based health center staff could be involved, whether that's leading, instigating, or supporting an intervention. Once we developed the tools, we began working directly with school-based health centers across the country. We created learning collaboratives of 8 school-based health centers at a time. Each center receives a stipend to support implementation of a small-scale intervention and to support their participation in a peer learning collaborative. We would then take lessons that we learned from one collaborative to the next collaborative, and so on. Over the course of our work during the last few years, we developed case studies featuring many of the school-based health centers that have conducted projects, and you can find them at the URL listed here. But I've always found that instead of reading case studies, it's really ideal to hear them directly from the experts themselves. So we're very lucky to have with us today speakers from 2 school-based health centers that were involved in our learning collaboratives and have really been leaders in managing the environmental factors that make asthma worse. So I'll start by turning it over to Amanda.
Good afternoon, everybody. I just want to say that we're very grateful for the opportunity to participate in this project, and hopefully some of the strategies that we share you find helpful to your organizations. So we are located at, in Albany, New York. Whitney Young Health Center is a federally qualified health center, and we work primarily with a population that is living in poverty. So we've noticed through our school-based health centers that asthma does have a significantly large impact on our elementary students. So the south end of Albany, in a specific zip code, had asthma ED rates 4 to 5 times higher than our region, and then another region, our upstate region. It was also 3.5 times higher than Albany County overall. So this specific area had a lot of students that were continuously using the ER in order to treat and or manage their asthma symptoms. Similarly, with our west end, again, another area where we have a school-based health center, had higher rates than the capital region or upstate New York, and again, higher than the county. So we really wanted to target these areas and work with our school-based health centers in these areas. We found that there are numerous environmental triggers that were contributing to these rates: mice infestations, public housing, older buildings, moisture, leading to those elevated absenteeism rates, ER utilization and hospitalizations. And also of interesting note, one of the topic areas of the annual Albany County School Nurses meeting was asthma. So it was something that everyone was very aware of being a significant issue, and something that the community was trying to pull together in the schools to figure out how we can address this. So our interventions, we use the inform incentivize approach, focusing on 3 target populations. We just couldn't decide which one we wanted to do, so we said, let's do whatever we can with all 3 populations. So our first area of focus was caregivers of students with asthma. Often this meant not necessarily mom and dad. It could have been grandparents, aunts, uncles, and sometimes even involving, cousins and things like that, that primarily are the ones that are taking care of students during the day after school when their parents aren't home. School staff and also students themselves. So for caregivers, our intervention involves education via virtual platform. So we utilize student interns to develop and engage participants, developing this website where it's a Breathe Better website. We did a lot of promotion for this using QR codes, and we worked collaboratively with schools to promote the utilization of this. So when we had health fairs and things like that, we would always bring information on this website. And we also used an approach where we incentivized participants to complete surveys that were on the website. So if there are specific areas of the website, as you can see, we have part of the website was dedicated for kids, for caregivers, and then we also had county-specific resources, other resources, and at the end of each page, there were opportunities to participate in surveys. So those surveys actually gave us a lot of information in terms of common misconceptions of the caregivers of individuals with asthma. So what we did then was we were constantly looking at the results of those surveys to tailor materials to address those misconceptions that we identified through those surveys. And then anyone who participated in the survey was eligible to receive gift cards. So for school staff, we also provide an inform, incentivize intervention. So what we did was in-person trainings with pre and post evaluations. We validated materials offered to teachers. And interestingly, we worked with the cleaners and we gave them a checklist to do, not only for kind of rating the school environment in terms of cleanliness and moisture, but also in rating the teachers that they work with. So a lot of times, if people feel like they're evaluating themselves, they may rate higher. They may say, okay, well, I don't want to get in trouble for us not having access to these supplies or for utilizing this over this. But when it came to them evaluating the teachers' classrooms, I think that they were a little more willing to be more honest, because it was something where it's like, okay, well, this is not necessarily a direct reflection on me or my job. So that was kind of interesting, and it gave us some interesting results. And we edited the checklists. So the original checklists that we had were significantly longer, so we wanted to keep them nice and concise so that we encouraged more, we encouraged actually the entire staff to complete them, and the entire staff did. And this resulted in products, changes in products being used, and that's something that we'll talk about in the successes. So our intervention with students actually was multifaceted. One of the great things that we did was provide lessons on respiratory health. So you can see kind of in the middle picture there, what we would do was we would take the first graders across all the districts that we worked in, and we would do respiratory health lessons, and also build into that a component of asthma, talking about triggers, talking about what it feels like to get air into your lungs if you have asthma. So you can see they're wearing their little respiratory systems, and then when they would breathe into the straws, they could see that the air was filling up their lungs and the lungs were expanding. So we had them pinch off the straws, and then they could see that it was more difficult to get air into the lungs, and maybe that's how some of their friends feel with asthma. We talked about triggers and how you can unknowingly bring triggers into the classroom that may affect your friend's ability to breathe. Another thing that we did was an asthma obstacle course. This was something that a colleague of mine created. It was absolutely awesome and very well received. So it was something where students would participate by going through different steps of ways to actually reduce those asthma triggers. So for example, you can see on the left-hand side, the left-hand picture, the number one was a rug. So they would start the asthma obstacle course by wiping their feet off before they enter the house. Then they would do things like taking food items and putting them into a sealed container, taking the garbage out, encasing a pillow. They completed these activities, and then oftentimes they actually timed themselves, and we would give out prizes for those who completed it the quickest. Or if they completed it all, we would give them an asthma comic book. For asthma-focused health fairs, this was actually very successful as well. So we implemented these across our schools, and as you can see, the attendance was pretty off the charts at most of the schools. So what we did was we partnered with anybody in the area that essentially provided any sort of support asthma-wise, including health insurance navigators who were able to link individuals to specialized care that maybe we can't provide in the school-based health centers. So we worked with our county health department. They offered asthma bingo. We worked with, we did our asthma obstacle course. We worked with even local food vendors. We worked with different organizations besides our health center that also provided, respiratory care, respiratory services, asthma education. And it was kind of everybody was welcome and invited. And families went around and they provided tickets, and they would get, a stamp or a sticker indicating that they visited a booth. And in the end, they were entered into raffles for great things like bikes. So like I said, we had many partners throughout our progress. We have an asthma coalition of the Capital Region. So they were vital in also spreading the word and helping us get together with a lot of the organizations that would help us with the health fairs that we did across the schools. At Albany City School District, the district itself was fantastic, the county health department, and then also the local schools as well for providing students. One of the things that we did at every health fair, which was actually probably the most popular thing, was we did slime making, but what we called it was mucus. So then it would allow us and the pharmacy students to have conversations with kids regarding mucus and asthma. So our success story that we really wanted to share, one of the great achievements that we're very proud of is after the National School-Based Health Conference meeting, we met as a team across all the school-based health centers that were involved in the project, and we actually shared a lot of strategies. So what we did was we tailored school staff education specifically to the maintenance team at a school. So we worked specifically with the maintenance team, and the principal at the school was very supportive, and she assisted in helping us schedule time so that everyone could be present. So we did an informal education session, so it wasn't something where we sat down with a PowerPoint, but more we had our providers come in and sit down in the cafeteria with the staff and just informally talk to them about asthma, the cleaning supplies they were using. What we found was the maintenance team was very open and honest in that kind of setting, and they completed the assessments willingly. We we had all the assessments returned to us. An interesting thing we found out was cleaning staff was actually bringing in rags from home and using those to clean in the schools. So for us, what we did was we provided them with microfiber cloths, and they were extremely happy to have those and very willing to use those. It wasn't something ideally, that they wanted to be using rags from home, but something that they had found that was necessary in order for them to get what they needed. Also, one of the things that they were using prior was bleach. So they weren't necessarily diluting it properly every time, which was triggering some individuals' asthma, and actually had prior to this, initiated quite a few discussions between our staff and the nurse with the maintenance team. So at this point, by explaining to them, this is why we need to have it diluted and/or this is the effect that it has in the informal setting, after following that, the staff, the maintenance team there no longer, we never had any issues with any of the, bleach products being used or not properly diluted. So really for us, we are extremely excited because we feel like we've achieved something that's very sustainable for us. So we had that behavior change by the maintenance teams, like we talked about, and it was incredible because, following that, not one issue did we have with the cleaning supplies that they were being used or the bleach, the strong bleach smells, anything like that. Also, we continue to use and develop the asthma website where we can update it, we can evaluate perceptions, and continue to tailor the guidance that we provide to families. Also, what we did was we expanded respiratory health education. So again, adding lessons on mucus because of the hit that it was with children making slimes at health fair, we decided to add more to the lessons and/or add a second part where we could talk to them about mucus and boogers, which they love talking about. And then also the health fairs. So even though we don't necessarily have the funding right now dedicated to it, we've made it a priority to continue to have those health fairs in the future because the outcome was so great and the families did show up, partners were engaged. So now that everyone's really engaged, we feel like we can sustain this because it's now more of a community effort. So again, we really appreciate the opportunity to participate in this project. Our team was really excited to do this, and we think that what we've achieved here is something that's going to continue on impacting our students that we work with in the future. So thank you to Molly and Anne.
Thank you, Amanda. That's an inspiring story. I love seeing the photos of the people impacted by your work, and I think so many of the things you described are indeed replicable. So now we're going to turn to our second case study, and I'm going to invite our colleagues Kay and Todd from the McKean School-Based Health Center to talk about their work.
Hello, my name is Kay McLean Grant. I'm a nurse practitioner and site manager of the McKean School-Based Health Center, which is located in Wilmington, Delaware. We also were very appreciative to be a part of this national collaborative project. Our asthma project focused on empowering students and their caregivers to successfully reduce common asthma triggers in their environment, especially focusing on the teen bedroom. We are located in a public high school, grades 9 through 12, with about 900 students. Our center is part of a larger school-based health care system of 20 centers managed by Christiana Care in Northern Delaware. The school population at McKean is racially diverse and composed of teens 14 to 18 plus years of age, who primarily live in or near what is considered the inner city area of Wilmington. Our students are challenged with multiple risk factors for both developing asthma and for suboptimal symptom control, including living in multifamily dwellings with an increased risk for mold and insect infestations, urban pollution, compromising air quality, and often limited financial resources. Frequently, our students cannot identify a consistent PCP, further compromising their asthma management. So year one of our project focused on educating students to identify common asthma triggers in their bedrooms and on providing them with tools and instructions to remediate the environment where they spend significant amounts of time. Students identified as being diagnosed with asthma were invited to attend group sessions and cohorts of 6 to 7 students. At each session, either Todd or I or both provided age-appropriate education about asthma including common symptoms, treatment and management strategies, and especially asthma triggers, and recommendations for our teens to improve what they could in their own bedrooms. We adapted a worksheet that coached students to identify triggers in a mock teen bedroom display and encouraged our participants to apply this knowledge to critically evaluate their own rooms. And we provided tools for remediation, including microfiber dust cloths, pillow, and mattress protectors, and held drawings for gift cards to encourage participation, such as by sharing pictures of their interventions. Okay, this is a photo page of year one. You can see our mock teen bedroom display. So teens were able to tour and interact with props, and they could open the drawers of the bedside table to discover leftover snacks and the resultant cockroach and rodent infestation. And no worries, these were plastic versions. Our bedroom was full of asthma triggers, including stuffed animals, shag carpet, excess clutter, and heavily scented products. And there's some of our students happily receiving their microfiber dust cloths.
Hello, everyone. My name is Todd Hartsock. I am the Senior Community Educator for our school-based health centers and the CHW for McCain. I'm going to speak on our outreach for year two. We focus primarily on planning our asthma education event for parents and students. And for this event, we worked with our two elementary school-based health centers that are part of our district and are more centrally located within the community. We mailed home invitations to the cohort participants as well as elementary students with an asthma diagnosis. Then we followed up with phone calls prior to the event. And at the event, we had 5 interactive education stations where attendees had the opportunity to participate in games and activities, all geared toward asthma education. At each education station, we gave away asthma prevention products such as spacers, books, pillow covers, and microfiber dust cloths. We also had several local community partners set up tables so that attendees could get connected to other resources and services. And at each table, participants visited at each table that the participants visited, they received a raffle ticket so that they could enter to win a larger prize after our keynote speaker. We raffled off mattress covers, doormats, and HEPA vacuums. And we also gave away some fresh produce to our families as well. And it was really nice because everyone left with something that came to the event, and that also included dinner. We provided pizza for all of our attendees. In the pictures here, you can see a glimpse of the event as well as one of our education stations where families learned about asthma-friendly cleaning products, and each person that came to this station was given a microfiber dust cloth. So in order for our efforts to be successful, it was important to have some key partnerships. The McCain school staff and nurse were very helpful in recruiting cohort participants. And then specifically for the event, we collaborated with the elementary school staff and school-based health center staff, as well as our local community partners and other school-based health center staff that were available to help during setup, cleanup, and throughout the event. Additionally, we also had some volunteers from one of our summer programs, Camp Fresh, and we had some teens that came and helped at the event. It was definitely an all hands on deck effort, and we were very much appreciative of everyone that was able to help make the event successful. So as far as our outcomes go, we were hoping for a little higher number of attendees, but we were definitely satisfied with the turnout considering this was our first event. And we feel very lucky to have been able to host the event at all because it was just a few weeks before a lot of our staff were sent home because of COVID.
So as Todd noted, we would have liked certainly to have seen higher numbers for our outcomes, but really we walked away from our Asthma Ed Night feeling energized and full of plans for improvements and revisions, and we're busy planning our path forward now. There's a lot of things I think we did do right. Some of those are that we utilize small groups of students, and that increased student comfort and engagement. Another thing we did is we utilized the ACT screen, which is an asthma control test. And one of the meetings that we had with students, we had them fill those out. So that gave us an objective measure of their asthma control. And then we were able to schedule students with low scores, which indicate suboptimal control in for a medical visit, where we could address such things as medication availability, and if they needed help with that, compliance with medication, were they using spacers, were they using it correctly? So that was helpful. Another thing was that we were able to offer products which gave students and families the practical tools that they needed to make the positive changes. Moving our event to a more centralized location was a good idea, and bringing in our elementary schools, which are our newest addition to our system. Making our Asthma Ed Night interactive with games and giving prizes with the asthma control products. They all walked out of there with a spacer, among other things. Our partnership with the community health worker role was really optimal for us for Project Momentum and for helping us stay organized with all the details. And finally, we had our participants fill out a feedback survey so they could let us know their thoughts about our projects, and we could use their feedback as we planned our future with what we want to do with this event. So this is an ongoing project for us. Todd and I are currently developing a toolkit that we want to roll out for 2021-22 school year, which we hope will be our post-COVID world. We plan to offer this to our other centers and to invite the medical providers and community health workers at those sites to work as a team to implement education sessions and to provide those medical visits. And we fully anticipate that our next Asthma Ed Night will involve more schools and hopefully draw in more families who can benefit from this event moving forward.
Great. Thank you so much, Kay and Todd. I really love how you empowered the teens to manage environmental triggers in their own space at home. And I think that now, as so many people are spending more time at home than ever before, these kinds of home-based interventions are really important. And it's great to hear you'll be able to continue the work as well. I'll now turn it over to our colleague, Molly.
Hi, everyone. Yes, agreed. And it's really amazing how adaptable everyone has been in this moment. And so this slide really displays that hopefully everybody on this call already knows that school-based health centers are really and truly now more than ever uniquely positioned to do this work. One, school-based health center staffs are passionate and knowledgeable. You're the health experts on campus. Often, if not all the time, you focus on serving the most vulnerable populations on your school campuses, those low income and communities of color. You are the link between child, school, family, and clinical systems. And as Amanda, Kay, and Todd really displayed, you have a lot of flexibility, especially in working with schools. You're able to navigate the various systems that exist on school campuses and within clinics to change course, make updates, and do it in a really timely way, as opposed to those other systems that you navigate within. And finally, you have always been adept at doing more with so much less, which again is now more important than ever. And so I'm going to share next our new, exciting, amazing Tips for Success tool. So you'll see a link on your screen in front of you, but I'm also sharing something in the chat box that you'll be able to use. From the amazing work of the cohorts that we've worked with, that Amanda, Kay, and Todd were all part of, we built upon our work with the Asthma Intervention Guide, and now has resulted in the creation of this Tips for Success tool, where we've really built upon our lessons learned. And this curated collection of 6 tips will help you be the most successful in your work in implementing various interventions. And I'm going to briefly go over these tips one by one with some examples and highlighting the work that Amanda Kay and Todd already shared, but in the context of these tips to really help you think about how this could work for you on your school campuses or within your organization. So the first tip seems pretty straightforward. You want to assess the problem. It should seem like it goes without saying, but you want to select an intervention that really addresses the greatest needs in your community. That requires knowing, are there particular triggers that are causing problems in your community? Are there particular settings where students are facing triggers? So we already talked about, like, is it a home trigger situation, schools, when they play outside? And there are actually many data sources that are already available to you and easily accessible to the public that you don't have to pay for. That includes data from your local health department, air quality data from your regional air district. So if any of you live in California, you might be quite familiar with getting that air quality data now. And information from student health forms or medical charts. And it doesn't have to be that complicated. It doesn't have to be like a deep dive into the data. This can also be your own knowledge. This could be conducting brief interviews with students, like having conversations, casual conversations in your clinic setting, or phone conversations with parents and teachers or community partners about what's happening and how young people are being affected. And you may already have observational data. So you may already have some observations about mold existing in your school or buses idling outside of your clinic setting. And one particular example that I want to share is at a school-based health center in New Mexico. The coordinator, Tilly, already had a small group of students with asthma that she provided education to. And she asked them about the triggers that they commonly face in school. And over half of them said that they actually have trouble breathing around body sprays and colognes, which is actually really common among middle schoolers. So Tilly worked with this group of students to develop posters to hang in the locker rooms. And that's right now on your screen in front of you, you're seeing an example of this like public health campaign led for and by students that was created at that school-based health center in New Mexico. The second tip that really bubbled up for us in doing this work was selecting an intervention. And Anne already mentioned the guide and how to use it. But the at-a-glance tool, if you haven't already clicked on it and started multitasking while you're on this webinar, is really going to help guide you in a variety of different interventions that you can use without having to reinvent the wheel. We've worked with a variety of cohorts, and this guide and at-a-glance tool is really helpful. And once you have a good sense of what you need, you move on to selecting that intervention. So we just ask you to flip through the tool. There's page numbers here. We've already shared that a variety of strategies can be easily found. And so, for example, if your assessment identified problems with mold and cockroaches, you may want to establish a referral system for an asthma home visiting program in your community. Or if you learn that cleaning products like bleach are a problem, so Amanda already mentioned this, you may want to provide either some educational appointments with your maintenance staff, or if it's an issue in the home, really providing your folks with friendlier cleaning products. As we saw, like the incentives that were given away were microfiber towels. So that's another example of a best practice. And you'll find details about these interventions deeply in the guide. So we really encourage you to get into it. The next tip should be, again, pretty straightforward, but we can't say this enough. You know, we all know you're uniquely positioned to do this work. And one of the reasons is because you're able to build relationships so effectively. So getting buy-in from your principal is something that many school-based health centers already do every year. But that could also mean, you know, shifting a little bit and figuring out how to get on a staff meeting agenda in this moment when there's so many competing priorities. So again, that flexibility and shifting and being really knowledgeable about the health issues on your campus among your student populations is ever more important when you're talking to your key stakeholders like your principal. And getting buy-in from teachers means that they might be more likely to make change as well. One challenging and important group to get buy-in from is the maintenance staff. And Amanda's example of that really displayed how she was so flexible in that moment to shift even the way that she talked to the maintenance staff about cleaning on school campuses. So as opposed to saying, you know, you need to dilute your bleach immediately, she framed it more in like what's happening in the classrooms and how she talked to them about a space that both teachers and maintenance staff were responsible for, so they didn't feel like they were totally on their own and that they were being blamed and responsible for the state of the classrooms. And so that's just a really good example of how school-based health center staff can shift the conversation and continue to build relationships. You know, all those skills that you have in working with students in clinic can also be applied to working with adults in framing conversations and avoiding blame in these moments. Tip number 4 is really about achieving success with your community. And this truly means some community health work, meeting your community where they're at, literally and figuratively. And I think this is best displayed by an example from a school-based health center, an elementary school in Richmond, California. Elazar, the clinic coordinator there, provided parent education sessions right after school started, which most of us would not think of that. We'd think like, oh, lunchtime or in the afternoon. And some of us may be familiar with coffee sessions. So this is based on that idea. So right after school started, kind of that key window after parents drop off their students, but before they have to get on to the next thing, he provided this space for parents to come together and learn about triggers in their home. And what he learned from those first few sessions is that many parents had triggers in their homes that were results of substandard living conditions and that their landlords refused to address, which meant mold and pest infestations. And they shared that they were afraid to complain for fear of housing retaliation, like eviction or increased rents. So what Elazar did is he shifted and was flexible in that moment, met them where they were at, and talked about asthma triggers in the home in the context of a tenants' rate guest speaker. So he brought in a tenants' rights guest speaker and still was able to educate the parents about triggers in the home, but also was able to address their true fears about housing issues. So we know this slide, developing a plan of action, can be hard to sit down with a chart and really map out what you're going to do, but we can't stress how important this step is and this tip is, which is why we included it here. It's very important to write down your goals, and it helps you commit to action steps for really doing the work. So for each outcome you want to achieve, think through the steps that will get you there. Then we want you to write down these steps, conduct them, and really map out a feasible timeline. And there are a lot of templates out there, and we've included one in our Tips for Success guide that's really simple, that can just get you into the work instead of formatting something in a Microsoft Word or a Google document. And the reason we have a column that says who is responsible or who needs to be involved is because you'll generally need to engage an array of partners to successfully implement the work and implement an intervention. Whether that's other staff at your school-based health center, school staff, students, parents, or your partner organizations, you'll want to develop your work plan in partnership with them. And you'll want to hold team meetings with them regularly to check in progress. And so we think this tool is particularly helpful to help guide that. And that's why we included it as one of our tips. Finally, tip number 6 is really about connecting with others doing similar work. And some of you may already have partner organizations that are helping you address asthma in your community, but not every school-based health center across the country is connected in their region or state. If you are, you're already doing this important work. So it's already important to have organizations to bring that broad 30,000 level foot view, but also bring in resources for you and help build your capacity. Once you have success, You'll want to be able to sustain your work, and sustaining doesn't necessarily mean fundraising. So we really want you to think about, you know, anytime anybody hears the word sustainability, it gets a little like, oh God, they just want me to find another grant. That's not what we're talking about here. We want you to think about how to share your work internally, externally with your school campus, because then that gets all these amazing stakeholders, all these community organizations on track with you in that moment. And a great example of this is one school-based health center in Connecticut found success in talking with students about their asthma triggers. And in an effort to systematize that, they had trigger information added to their existing EMR system so that every provider across their healthcare system would be prompted to discuss asthma triggers during every visit. So that's not necessarily a funding shift. They were just able to add something to their EMR. And then additionally, another example is an SBHC in Pennsylvania worked with teachers to integrate lessons on asthma into their curriculum. So if you don't have the staff capacity to go in and do educational sessions, they utilize teachers to really integrate that into their art curriculum and their science curriculum, which was really helpful. And I just want to say that we know it's not inherent in school-based health center work to talk about your successes and brag, but we know how important that is. You can be a source of inspiration. That's why we invited Amanda, Kay, and Todd on this webinar today. We want you to know that when you talk about your work, others learn from that. There's so many nuggets of best practices in just telling a story about your successes that others can learn from. And we hope you were able to kind of grab some of those today.
Thank you, Molly, and thank you all for joining us for the presentation today. I believe we are now open for questions and answers.
Thank you. Now is the time to enter your questions into the chat box in your Zoom control window. While you are entering your questions, we will also launch our poll questions. Again, your feedback is vital in helping us craft presentations that meet your needs.
Okay, we've got one question that just came through to the panelists, and it asks, what can you do when there are multiple indoor triggers like mold and the landlord won't remediate?
That is always one of the toughest questions that we get and have gotten for years working in the field of asthma. When thinking about the environmental asthma triggers that people are likely to find in homes, there's a subgroup of them that are within the control of the tenants. So things that you can change through behavior change. You can make sure that nobody is smoking inside the house. You can keep the furry pets out of the kids' bedroom. You can change the cleaning products that you're using to be asthma friendlier. But yes, it's true that we do often hear about environmental asthma triggers that result from substandard housing conditions that the landlords refuse to repair. And the most common that we see directly related to asthma are mold and pest infestations. So sometimes if there are community health workers or other asthma educators that are working with the family. They can jointly approach the landlord, provide education, and convince the landlord to make the changes. But sometimes, as Molly shared, people are too scared to even ask for those kinds of changes for fear of retaliation. And so we do encourage people in those cases to get in touch with free legal aid services in their community to make sure that they understand what their rights as tenants are, because having access to safe and healthy housing is indeed a right, and your community and your state will have specific laws related to tenants' rights that we'll want to make sure you understand before you complain to a lawyer. So going to free legal aid services would be a great way to get that process started.
Yeah, and I would also echo that, absolutely. And I think that if your school-based health center doesn't already have a relationship with a local legal aid office, I would encourage you to try to build that relationship, because you'll find that as a referral system is so helpful in general for a variety of issues, especially tenants' rights issues. So that goes back to what we shared about having partnerships, building your capacity at your school-based health center around that work, and also talking to other people within your clinic organization to see if somebody else, another program within your clinic has that relationship already.
Great. Thank you, Anne and Molly. Another question came in that asks, any advice for children and families regarding asthma triggers exacerbated due to the fires in the Northwest?
Absolutely. This is a huge issue. Both Molly and I are in California, and so I think this is now the 4th year in a row, with each year getting worse, that kids in our communities have been facing wildfire smoke and the ongoing health threats to children with asthma as well as to healthy people. So first I want to point that on our website, we have a section focused on wildfire smoke and asthma. So the website address is rampasthma, rampasthma.org. And if you scroll down to about the middle of the bottom portion of the homepage, you will see a link to resources. But in general, the recommendations are to stay inside whenever possible and to try to find a way to keep the indoor air as clean as possible. And so what scientists are recommending are portable air purifiers that are not ozone emitting. So a portable air purifier, and the EPA has a guide on how to choose one to make sure that it is not producing ozone and to make sure that it's the right size for the space you're trying to keep clean. But so to have a combination of portable air filters, and then for people who live in homes where they can control their heating and ventilation system. So I'm recognizing that's not always the case in renters and apartment buildings, but if you are able to control that, then installing a filter in that is called MERV 13. That's the grade of the filter. That means it filters out a lot of the smallest particles from wildfire smoke that penetrate deep into the lungs. And so those two things are good recommendations for cleaning some of the particulates out of the air. And what families should also focus on is making sure that they're not adding to indoor air pollutants during this time. And so some of the things that add to indoor air pollution would be the use of bleach and other harmful cleaning products, cooking with a gas stove, frying on the stove top. Those are things that can make the indoor air quality temporarily worse. Even vacuuming, unless you're using a HEPA vacuum. And so again, on our website, I'll point to some resources, most put out by the EPA, that provide guidance on keeping indoor air quality healthy during wildfire season.
Okay, another one just came in that says, in Missouri, kids with known COVID exposure are allowed to still come to school. Will the maintenance staff in schools be able to maintain a safe, clean school environment during this COVID period? I'm not sure if that's something you all have had any conversation about with the schools you're working with.
Right, it's a really important question. And We don't have any resources directly on that issue. I know that the EPA has had webinars on school cleaning for reducing virus spread. And I think that it is a combination of different cleaning products and practices, as well as ventilation and filtration. And we can, you can search for those on the EPA website. And or I could follow up with anyone who's interested if you want to email me directly at Anne, A-N-N-E, at rampasthma.org. I can find links to those webinars that the EPA hosted and share those with you.
Thanks, Anne. And Molly, I think you started to answer this about relationships, but a question came in asking if there's any more information about how students are referred to a community health worker.
It depends on how your school-based health center is set up. I would also see if Amanda or Kay and Todd have any on-the-ground experience about how that's worked in their school-based health centers in this moment, how it's been working to refer students to your community health workers as part of your larger clinic. Any thoughts, Amanda, Kay, or Todd?
This is Kay. So we added community health workers to our staff a couple of years ago. At first, we really weren't sure how we were going to utilize them, and quickly realized we started with one and needed way more than one. Todd is the lead, so I'll let him discuss this as well, but it works pretty smoothly. We've been able to, we have the support of our system that allows us to have community health workers. We can pick up the phone, we can send emails, and Todd's even developing a new system this year where we can fill out a form and send it to him electronically. So we have lots of different ways of utilizing these health workers and are fortunate to be part of a health system that supports that.
Yeah, and I would just echo that those systems are so important. So if this question was about referral forms, make sure that your referral forms are updated, available, especially if you have an internal community health workers that you're working with. If you're talking about referring out to community health workers at a partner organization, those referral forms are ever so important as well, along with your agreements with them. So one that's about building a relationship with whoever's providing your community health work, and making sure that you have tracking and monitoring systems to ensure that none of your students and families fall through the cracks in that moment. Yeah, thank you. And anything to add, Todd, before we wrap up?
No, I think Kay hit the nail on the head. I can vouch that I wasn't even sure when I first started what all I was going to be able to do to support, but I recognize the value in having myself and the other community health workers in our school-based health centers, where we're able to really able to meet our students and families where they are and try to best support their social barriers that keep them from taking care of their health. So I'm all here for it.
Thank you, Todd. That role is so important. And we appreciate that you joined us today to talk about that. Mm-hmm. I want to point out that our colleague from the US EPA, Sheila Brown, has posted in the chat box the link to the webinar I was talking about on healthy indoor air environments and school plans and practices. So thank you, Sheila, for doing that.
Great, that's all of our questions. We're going to pass it over to Ufoma to wrap up.
Alrighty. If there are any additional questions or concerns, please send them to the email on your screen, info@sbh4all.org, and we will forward them over to our presenters. As a reminder, the recording of this webinar, the slides, and any resources shared will be archived on our website in 2 to 3 business days. We want to again thank you for attending our webinar today and extend our sincerest thank you to our presenters for today. Thank you and have a wonderful day.
Thank you all.